First things first, there are 15,251 confirmed aggregate cases of coronavirus in Victoria. That's 331 new cases since yesterday's update. I'm saddened to have to report that there are now 246 Victorians who have passed away due to this global pandemic. That is an addition of 19 further deaths. The number increases by 18. It's the same as yesterday. There's reporting done in quick time, and sometimes there's just a need to reconcile. So 246 is the accurate total. It has only gone up by 18, but there are in fact 19 additional Victorians who have passed away. I can't provide too much detail, but what I can, I'll now go through for you. One female in their 50s, one male in their 70s, 6 females in their 80s, 4 males in their 80s, 4 females in their 90s, and 3 males in their 90s. 14 of those 19 deaths are linked to aged care outbreaks. Can I take this opportunity on behalf of all Victorians to send our condolences, our sympathies, our love and support to each of those 19 families. This will be an incredibly difficult time for them, and I hope that that pain is made a little more bearable, knowing that Victorians are with you in grief and loss and sadness. There are 650 Victorians in hospital. 47 of those are in intensive care and 24 of those are on a ventilator. A total of 1,854,688 test results have been received, which is an increase of 34,090 since yesterday, so a significant day in terms of test results and activity. There are 2,903 cases with an unknown source. That's an increase of about 100 since yesterday's report. 1,185 healthcare workers who are active cases. That's up, but up by a smaller number than has been the case in recent days. But it really does, like so much of this data, it takes a longer time period before we can start to see whether there's any pattern, any shift in those infections. Each of those are of great concern to us. Each of those are motivating us to redouble our efforts right across the board to make sure that we're protecting those people, taking care of those people who take care of us. There are 1,838 active cases in aged care settings and 7,880 active cases across the whole state. The regional metro split is pretty well constant. I think we're up now to just under 520 regional cases, so a small increase, but nothing like the increases we have seen in Stage 4 metropolitan Melbourne, albeit those numbers do seem to be stabilising. But I again hasten to add, I'm not here today to provide you with any definitive claims about trends. That'll have to be borne out by the actual data, particularly as each day passes where we have the impact, the effect of Stage 4 restrictions. I just wanted to make a couple of references to a couple of issues that have been topical for all of us for many weeks now. Aged care shifts. We have sent into aged care facilities, private aged care facilities, nurses that have covered 1,148 shifts. That is a massive effort in often confronting and challenging circumstances. So I just want to send the best wishes and the thanks of every single Victorian to each and every one of those nurses, and I have to say to their families. This is a very, very challenging environment, and those nurses have done us proud, together with personal care workers and a number of others, many of whom don't necessarily have a clinical qualification or wear a uniform, but the coordination and the planning of our crisis response in a number of these private aged care facilities has been a credit to all of those involved, and I'm very proud of them. So that's 1,148 shifts. That is a massive effort, and everybody involved, I'm very proud of you. I'm very, very grateful, and I know that despite the very challenging circumstances that so many people in private aged care find themselves in, I'm sure the care and the courage and the compassion of those nurses and others are not only is that a comfort to residents, but it's certainly a comfort, I'm sure, to family members as well. I just wanted then to give you a quick update in relation to business support, and then we can move to taking your questions. There are Payments of $5,000 have been made to around 24,000 eligible businesses. That's totalling $120 million. That was that $5,000 payment that we had announced. We have since increased that by another $5,000. Those businesses who have received that payment or have applied for that $5,000 payment will not need to submit further paperwork. They will be paid an additional $5,000 to take that up to $10,000 as a second wave payment, if you like, and there was also a $10,000 payment from the first wave, so that'll be for those businesses around $20,000 in support. I can also confirm that there's around $776 million or $77,600 $10,000 grants that have been paid out to businesses as part of our $1.7 billion economic survival package, one that we've talked to you about many times. But we are pushing those payments out as quickly as we can, trying to do that as easily as we can, trying to minimise the amount of paperwork and the time that's taken. The Business Victoria website is the place to go if you have received a payment or if you believe yourself eligible. That's where you can find the detailed criteria. Essentially, the job keeper criteria will see you through, and particularly reflective of some of those recent changes that we're grateful to the Commonwealth Government for having made those announcements. It essentially mirrors the JobKeeper, the criteria under the JobKeeper scheme. Just finally, we have today released some traffic data, so whether it be trains, trams, buses, regional rail, regional buses, as well as traffic data, road data. We're seeing a massive reduction. To give you an example, 43,000 tram trips and 71,000 metropolitan train trips, which is about 10%. That was on Friday last week, so that's about 10% of what we would normally have on a Friday in August. In other words, we've got a 90% reduction in movement. And I know that's very challenging, and I know why that's occurred, because we have sent home many hundreds of thousands of workers, but that data bears out that the strategy is working. That's one of the inputs in terms of the outcome that we're all working towards. We've got to keep seeing these numbers come down. We've got to keep seeing transmission at a much lower level. The public health advice to me, all of our experts remain convinced and very confident that as we adjust into the early parts of the second week, not even yet a full week of many of the stage 4, the most significant changes, we will continue to see data that forms a trend, and we'll continue to see numbers coming down. Exactly how long this takes and to what the lowest number we can get to, that's only time will tell. But there is no alternative, there is no choice. We've got too much movement in the community, too many cases, and until we address that movement, which this data shows we absolutely are, then we won't drive down those case numbers. Just finally, before we go to questions, we obviously remain deeply grateful to every single Victorian who's doing the right thing. We are a strong community, we are a proud community, we get through difficulty each and every year, whether that be in our own personal lives, in local communities, or as a whole state. We are, all of us, equal to this task. It is very challenging. We've never seen anything like this before. But if we all stick together and if we all work together and we understand that the contribution must be a shared and joint one, must be a shared and joint contribution to a collective benefit that we will all share in. That's getting through this quicker than we otherwise would, getting past these restrictions quicker than we otherwise would, and then beginning the really challenging job of rebuilding with strength and with an absolute determination to make sure that Victoria comes out of this stronger in the medium and the long term. That's what we're going to achieve. We are equal to this, but it only works if everyone plays their part. It only works if we all acknowledge that we are in this together and that we look out for each other. That's, I think, something we are well known for, something that I know has been tested. There is great frustration, there is anxiety and concern, there is a sense of fatigue. No one wants to be in these settings. But the public health experts have told us, they've made it very clear, this is the only way we'll get these numbers down. It's a 6-week strategy. That's much better than a 6-month strategy, which would have been the case if we'd stayed at stage 3.